come on to this webinar. We'll be doing the managed care quality monitoring webinar for monthly data check. So it's a big one, and we'll give people some time to come on. Hello, everyone. Welcome to the Managed Care Data Quality Monitoring webinar. People are still coming on, but we're going to go ahead and start. My name is Amy Peterson, and I'm the section chief of the Managed Care Data Support section here in DHCS. Next slide, please. Go ahead. And I wanted to go over some basic information. First of all, if you are on speakers or earphones today, go ahead and make sure that all of that stuff works and you've turned your volume up. We have a lot of speakers today and a lot of information. For general questions, please go ahead and submit to the WebEx Q&A message box. That's the chat. And go ahead and ensure that your questions are visible to everyone. You can also email the Managed Care Webinar inbox. That's mcdss@dhcs.ca.gov, and we will get your questions directly to who needs to see them, subject matter experts. Again, for specific questions, you also want to use that data mailbox. Today, we have a lot of speakers, as I said, and we have a lot of support staff here in the building working with us to make sure that this comes off nice and smoothly. Speakers today will be Debbie Dixon, Jeff Jennings, Eugene Stevenson, who you all know, Tyler Brennan, and myself, Amy Peterson. Support staff here working with us very diligently, Sujung Kim, Atif Habib, Samantha Van, and Abi Jabbar Saleh. Please go ahead and mute yourselves. And we will begin now. The agenda that we're going to be going over today is the 274 Medi-Cal Data Submission Standards, the 274 Medi-Cal Data Quality Monitoring Monthly Data Checks. All of that is provider data. The DHCS Documentation Center, which a lot of you have been accessing, that's wonderful. The ECMCS JSON file submission plan, and all of the communication information and our next steps. Next slide. First off is Debbie Dixon. She is the Data Quality Branch Chief, and she'll be going over the 274 Medi-Cal Data Submission Standards.
Right. Good morning, everybody. Thank you, Amy. I'll make sure this goes smoothly. So thank you, Amy. As she said, I am the chief of the data quality branch here in the Health Information Management Division at DHCS. Next slide, please. So we're going to be talking about the 274 provider data today. So a couple of things. We just wanted to start with the basics. We're going to talk about the submissions and then the monthly data quality checks themselves. So obviously, first and foremost, why are we measuring? What's the data quality monitoring objective? So you see here there are two APLs, and as you know, if you have attended this in the past, those links, you can click on them and it'll take you to the documents. So there's more detail in those documents about what the requirements are for the claims that go into our PACES encounter system, and the 274 feeds into the network certification requirements. So those two APLs will give you a little bit more detail on what that means, but we'll talk a little bit about some of that today. All right, next slide, please. So we did want to remind you that we've got a test environment out there that mirrors production environment. If there's anybody here that hasn't been, that may be new to a managed care plan, I do want to remind folks that what we're talking about today is medical managed care and how we do things today. This is how we monitor and how the workflow takes place and the data flow as you see here on the screen. So if you're having trouble, if you're new to submissions or having issues testing or having any kind of trouble, be sure to use the test environment until things work out and then submit into production. Just a reminder. Right, next slide, please. And here again is something your technical people will be interested in. Here's the transaction data flow. It shows the reporting structure on the managed care side, plan side there to the left, and then our flow into the PACES system. The files come in through the SFTP folders, go into the PACES encounter system, and from there into our data warehouse and other downstream systems. Next slide, please. All right, so let's talk about the transaction data flow. So as you see here, or may know if you're a current plan, each plan has both a submit and a response folder. The files come through the secure file transfer protocol, the SFTP as you know it. So that goes into the submit folder. Then the file should only contain the provider network that's in place for a single healthcare plan and must be comprised only of the 274 transactions. For those of you that don't know, the HCP refers to the healthcare plan. That's a 3-digit code. Managed care plans would know what that means. So the specific HCP must be included in the file name and in the file ISA segment, the ISA segment. So again, your technical folks will know what that means, and that information is included in the companion guide. We'll talk about that a little bit later. And each submitted file must reflect the entire network. So the process from the submitted file flows to the secure internal server for the file validation. Next slide, please. All right, so any responses in that file are posted in the response folder. So the response file returned, as you see there, we refer to it as the VRF, validation response file. So that is a custom file that gives you all the details of what the errors are, the number value, the messages, all that good stuff. In the XML form, which that just means it's a readable file that describes the structure of the data. So identification of each record shows the number value of the message so you can tell what the errors are. So the file is either accepted or rejected. There is no partial. It's the whole thing. It's all or nothing. So if the file is rejected, then the plan must make the corrections and submit a new file by the 10th of the month following the reporting month. That's the reporting timeline for managed care or for the monthly data checks. And the plans can also submit corrections to accepted files at any time, just in case that's something that you aren't aware of and want to do. Next slide, please. All right, so when the submitted file is deleted when it's processed out of that submission folder. If there's any errors found, the file can't be corrected at the record level. As I just mentioned, an entirely new file must be submitted. Every now and then there may be an issue with the server and that response file can be delayed. So just wait about 24 hours, check again, then reach out if there's been no response after 24 hours. And as I mentioned earlier, there is a 274 Provider Directory Companion Guide. This is the most current version, and that's available in the Documentation Center. You're going to hear a little bit more about the Documentation Center later today. So that link will take you to that site. All right, next slide, please. All right, so the rules for submission. You must submit the 274 and the managed care program data and primary care provider assignment by the 10th of the month into the PACES encounter system. So all plans must submit their submission reconciliation form template by the 15th of the month following the month of submission to PACES. So the example there for January data, you would, the deadline's February 15th, 2023. Any warning messages in that SRF must be corrected and resubmitted. All right, next slide, please. Okay, so we're going to show you some of the issues that we see that are quality issues and could happen with files. Maybe there is a transposition of letters, as you see there in that common error example. Could be an underscore instead of a hyphen that's used in the naming convention. We've put what the correct file naming convention should be here, that your technical folks will know what this means. And then the MCPD and the 274 example files, if you follow those, that's the correct file naming convention. One of the other things that we see sometimes are the National Provider Identifier, not on NPES. So NPES, as you may know, stands for the National Plan and Provider Enumeration System. That's where a provider applies for and gets an NPI. So every NPI field in the 274, the MCPD and PA files requires that that NPI needs to be found on NPES, not it results in an error. All right, next slide, please. All right, some more quality issues could be addresses with misspelled post names, forbidden characters might be used. It could be a mismatch between the county and the county code. Some questionable or unverifiable site IDs. So for those that may not know, it was formerly called OSHPD, as the acronym is pronounced, which stands for the Office of Statewide Health Planning and Development. That used to be the name of the site IDs. In 2021, OSHPD changed to HCI, which is the Healthcare Access and Information Department. So again, this is specific to site IDs. So you need to make sure that those, and that includes the dummy and invalid IDs. So just make sure that you know what those are and that they are accurate. All right, next slide, please. All right, now we're going to get into the monthly data checks themselves. So next slide. All right, as we've discussed, if you've been to any of these monthly webinars, every month we talk about the CART dimensions. So we use those dimensions to measure data quality to determine how well a data set meets the criteria for the completeness, accuracy, reasonability, and timeliness, as you see on the slide there. The descriptions of what those different dimensions contain is shown there, such as what you see for completeness there, missing duplicate data, that kind of thing. Accuracy, of course, typos and the questionable records that we talked about. Reasonability, is it valid and plausible? The example that we give here is you would need exactly one number for a distinct organization name, and it must correspond to the plan submitting the file, not any of its subnetworks. And then timeliness, of course, when is this due and did you meet that timeline? All right, next slide. So every month, the data quality reporting section, if you've been around for a while, it was the Provider Data Quality Unit and Encounter Data Quality Unit. PDQU and EDQU are familiar acronyms. Now it's the Data Quality Reporting section here in the Data Quality branch. They perform the data quality checks on those 274 submitted. There are 17 of those, as you may know. So each plan gets a report which summarizes their results. So the plans get an email with the reports attached, both the data check report and the flagged records report. So the email provides all the instructions and any pertinent notes or changes that you would need to know about, along with the due date for the responses needed to address any of those failed metrics. So for a plan to receive a passing score, They must, each of the HCPs must pass those 17 data quality checks. And if needed, plans are encouraged to refer to the reference material provided for the pass and fail thresholds. If that's something that's unknown to you, or if you're having issues trying to meet those, the details are in that documentation. All right, next slide. So here's an example of the reference. So each report has got a reference tab that describes what the data checks are, the number, the name, the pass threshold, the description, all of that stuff that you see here on the screen. There is a separate tab in that Excel file that goes with that report. So you can see what's supposed to be happening, what you need to do to what the pass threshold is that you need to meet, and the description of that. Next slide, please. And here's an example of the report. So there's the 17 data quality checks, the numbers associated with those, what they are, and whether there's a pass fail. So here's some examples of what that would look like and how it is in the report and the details that are provided along with that report and the email to the plans. Next slide, please. And resubmission guidelines. So the plans are expected to correct all those data quality issues outlined in those reports that you get, and then resubmit the entire 274 data file. As we mentioned before, it's a full, it's an all or nothing. We either accept it or reject it. So you can't do it at the record level. It has to be the whole file. The plans have to respond to all the failed metrics. You'll find that in the report, in the email on what needs to happen and how that reporting and the deadlines for responding and resubmitting are. So the files with any of the failed metrics that have not been granted an exemption have to be corrected and then resubmitted before the next semi-annual data check. You've been following these webinars. We've been doing these for a couple of months. A few months back, we did talk about the semi-annual data check. So twice a year, we true up, if you will, the reports. So you need to make sure that any failed metrics that have been targeted, if you will, or identified in the monthly data quality checks are resubmitted before the next semi-annual data check. Okay, next slide. And that's it for monthly data quality checks and the data submissions on my side. Back to you, Amy.
Actually, I think we'll just go ahead and dive into the documentation center portion. Deb, thank you. Great job. So let me talk a little bit about the DHCS Documentation Center, which is something that we hit upon once MS Teams was introduced as being a solution that allows us to quickly share documentation with the bulk of our trading partner community and avoids some of the challenges that we have in posting documents to the internet or sharing via other means. Next slide, please. All right. So I'll touch on the access request procedure and also talk about a little bit about the center itself and certain access issues. So the documentation center contains companion guides, technical documentation that's related to the JSON files like MCPD, etc., schemas, any artifacts that can help support managed care related documentation, including error documents that explain the errors that you'll find in response files. So to request access to the documentation center, you can send an email to data exchange at dhcs.ca.gov. I think we list it here later in a slide. Or you can click on the link here to the documentation center that's in the presentation, and that, if you do not have access, that will present you with the options for requesting access, and we'll go ahead and add that right away. Let's go to the next slide. Right, as I was talking about, it's mostly managed care related. We are looking at adding more documentation for other systems such as Short Doyle. But since Short Doyle has its own center at the moment, we're leaving things as is. There'll be more changes and we'll communicate that. One thing I wanted to mention about accessing the document center that we are learning is that it's not always available to 100% of our trading partners, generally based on organizational email policies or policies that have to do with MS Teams. So there may be instances, we've had a couple come up, that we are unable to give access to that staff person, again, either because of their organizational policies or some other technical issue having to do with their email address or email domain. In that case, what we are asking right now is that you contact your liaison contract manager or send an email to Data Exchange. We will get you the documentation that you're seeking and we'll work on a solution for you. If we continue to run into those, we may consider alternatives to posting the documents so that everybody can get to them. But right now, it's somewhat new, so we're working our way through that. And as was shared in the chat, the access, again, use that email, dataexchange@dhcs.ca.gov. And I'm going to just go ahead and answer a question. Is documentation equal the folders and files in DHCS SharePoint? Well, there are a number of SharePoint instances, so I don't think I would answer it like that. Documentation Center is a standalone MS Teams / SharePoint instance or site. And there are other DHCS SharePoints that are available to trading partners. So I wanted to distinguish between those two. So again, any questions that you have, please send them about the Documentation Center, finding a document, access, etc. Please use that mailbox there, dataexchange@dhcs.ca.gov, and we will do our best to address your questions and issues. Next slide. All right. I was short but sweet. Everyone lucked out. I'm not going to go on and on. But thank you. Please send us questions, access requests. We're more than happy to help.
Good morning, everyone. Today I will be covering the ECMCS JSON file submission plan. Next slide, please. So I'm going to take just a little bit of time to talk about the instance that's happening here within DHCS, or the initiative, I should say, is that DHCS is expanding the use of JSON itself. So currently, the JSON file format is used for the MCPD file. It's also used for PCPA, and I believe a couple other instances. The department is looking to lengthen the type of reporting that is occurring with this file format. Number one, it's very flexible. And number two, the department nor the plans need to ask for permission in order to utilize the format or to make improvements on collecting data. So for those reasons, the department is, as the slide says, expanding the use of JSON. Right now, that transition is happening between the quarterly implementation monitoring report and that is submitting the ECMCS data elements. Right now, the MCPs are preparing to submit ECMCS information, specifically enhanced care management and complex care management, SINs to the department by the 10th of every month, similar to 274 and the MCPD submission. Unlike the past, where onboarding occurred in a very rigid, phased approach the department is piloting a new flexible but straightforward onboarding process where the phases are taken into account in a new way. Instead of building the file layout prior to the plans submitting it to the department will work hand in hand with the plans in order to continue improving file formats until it is complete. This will include different staff that the plans will be talking to or exchanging information with in order to alleviate technical issues. And some of that communication will be coming forward in the future. And with that, we'll go to the next slide. I will turn it over to Tyler Brennan from MCQMD.
All right, thanks, Eugene. Hi, everybody. My name is Tyler Brennan. I'm a health program specialist working on the program side of community supports, but here to talk to you about enhanced care management and community supports, the JSON transition plan. So we can move to the next slide, please. All right, so this is the language that we have in both the ECM and the community supports APLs, essentially just stating that the managed care plans are responsible for meeting all program and reporting requirements as we specify as a department, following all applicable state and federal laws and regulations, contract, APL requirements, et cetera. Essentially just presenting our authority for implementing these changes. We do have the technical guides available through that DHCS documentation center that is available through a link at the bottom. We also have links available in the ECM and the community supports policy guides if you want to access them quickly under the monitoring and reporting section of those. So next slide, please. All right, so we're doing the JSON transition for ECM and community supports in phases to sort of make this as easy as we possibly can on all participants, all of our managed care plan partners. Phase one, which we're starting with the first test submission in November, so by November 10th, but the actual phase will turn on in the live environment in January. It's only going to be dedicated to collecting the SINs of members that are currently receiving enhanced care management and or complex care management. They can't be receiving both at the same time. So really it's just to sort of establish this file layout in as simple of a format as we can, and to get the ball rolling sort of slowly with phase one, and then we'll be picking things up a little bit more in phase two, expanding more of the ECM components that are currently included on the quarterly implementation monitoring report. And then that'll be by July of next year. And then phase three for the community supports expansion, that'll incorporate the community supports data about a year from now in January of 2025. Next slide, please. So this is sort of a visual of the timeline. As I said, we'll be undertaking this transition in 3 phases, and it will take at least 18 months to complete. A quick note, the QIMR process, the quarterly implementation monitoring report process that currently runs through Excel, that process will continue as normal, unchanged, throughout this transition until we sort of find out that we were in a place where the data is robust enough and the comparisons are matching up so that we can fully switch off the QIMR in favor of JSON. So as you can see on the screen here, phase one beginning in January 2024, it's really just starting off with the enhanced care management SINs and any member receiving complex care management. Phase two, starting in July of next year, we'll be introducing the ECM populations of focus, some of the eligibility, outreach, and authorization information we currently collect through the QIMR, as well as the network information. And then phase three in January of 2025, it's all community supports. So anything that we're currently collecting through the QIMR, we will be collecting through the JSON at that time. Next slide, please. So again, phase one is as simple as we could think to make it. And we've been asked to collect information related to complex care management. That's the one new thing that's part of JSON that's not part of the current QIMR. But we are going to be asking for that. So managed care plans must submit a JSON file containing essentially just that information in this upcoming phase. We will always and plan to always accept questions submitted to our ECM and community supports mailbox, which is given in the link there below. It's calamecmilos@dhcs.ca.gov. Any technical specific questions can be directed to the data exchange mailbox. That's already been mentioned. and we can help you out there as well. We've been opening up access to a number of folks as they request access. Usually it's very quick if you don't already have access, so feel free to just click that link that says I'd like access, and it should be headed your way pretty quickly after that. Next slide, please. All right, so these will be monthly file submissions where the current QIMR process is quarterly, so that's another change. Files will be due on the 10th of every month, with the first submission being due on November 10th. So the November 10th, December 10th, and January 10th submissions are technically test files. The first live stage file will be submitted on February 10th, and that will include data for January 2024. And just some of those details are here on the screen. Essentially, we'll begin validating the data with that February submission covering the January 2024 period. As I said before, the QIMR process remains unchanged, so please continue to be filling out the Excel templates for that process, and we will certainly be in touch if and when we are able to sort of fully convert the QIMR process to JSON. Next slide, please. All right. And I'll keep an eye out for any technical questions coming in the chat, but in the interest of time, I'll hand things off to Amy Peterson.
I am back. Thank you, Tyler. Sorry, I'm off mute. Thank you, Tyler. Thank you very much, Jeff Jennings and Debbie, for leading us through some of those really important areas. And always thank you to Dr. Eugene Stevenson for giving us the plan of action for the next steps. To go over some communication, we wanted to make sure that everybody who's on here knows that we are recording this particular webinar. We will post it, as we always do, at our webpage, and make sure that you have access to the webinar, the slides, and the transcripts. In addition to that, we have a lot of information on those pages. Next page, please, or next slide, please. For communication, again, group mailboxes included for the 274 MCQMD provider data at dhcs.ca.gov, that data exchange email for documentation center access requests, for any inquiries about ECMCS JSON files. You do want to contact the CalAIM ECM ILOS at dhcs.ca.gov. And for any questions about this webinar, please go ahead and put in your subject urgent in brackets, and that email would go to us at mcdss@dhcs.ca.gov. And we'll get back to you, and we'll also forward your questions to subject matter experts. So you don't have to think about everything right now and put it in the chat, but if you do, we're going to give some time for folks to be able to answer your questions as they come up. Either look in the chat as things are being typed in, or go ahead and type your questions in the chat and we'll get to them. We'll have some time after this is finished. Next slide, please. MCPs. We have some contact guidelines for you. The managed care plans are limited to 4 plan contacts. Those are folks who are your technical contact or your primary compliance contact. And you don't want to include contacts or group mailboxes that should not have access to certain information, such as like a corrective action plan. Assign a liaison to DHCS from that managed care plan, from your managed care plan. The liaison will distribute that information appropriately as needed internally per your requirements. Next slide, please. All plans should have assigned analysts. That is a primary contact and a backup contact for us. If you are unsure about who your current analyst is, go ahead and reach out to the provider box below, MCQMD provider data at dhcs.ca.gov, and we'll get you the names of your contacts. Next slide, please. If you have any plan inquiries of any type, please do the following. You want to send that inquiry to your plan's assigned analyst. You want to CC your plan's backup analyst. You want to CC the provider data group, MCQMD provider data at dhcs.ca.gov. And again, if that message is urgent, please mark it as urgent in the subject line. Next slide. We're going to go over some next steps. Next slide. Okay, here you can see the DHCS data collection status. Everything that is in production is actually happening right now. The county is being phased in for production for the county mental health plan 274 provider network data. That is also moving forward, and we will be moving forward with the drug Medi-Cal ODS plans. Those will be in production by March of 2024 as planned. Next step, please. Resources. Again, this is our page that we are posting the webinar series information on. There's also an FAQ page, a glossary of terms, and also those contact emails. So next slide, please. When you get this slide deck, you will have live links that you can hit to go ahead and get into everything. You can save that, but the webinar page itself, and it's in the chat, this has all of the current recordings, transcripts, and the actual webinars of that we're doing as we go. The frequently asked questions page comes directly from all of you, and the glossary of terms is everything that we think needs to be spelled out or addressed, because a lot of things are worked on as acronyms, and we realize that this is going to be used to help new staff understand what DHCS needs. Next slide, please. The upcoming webinar schedule, again, this is October. We went over the monthly data checks. In November, we'll be doing the 274 DMC ODS plans. The December is going to be managed care plan data, is that MCPD, and provider data files and expansion. The January semi-annual data checks will happen, and it will be connected to corrective action plans. February is the behavioral health short Doyle, which has not been discussed yet, and March is the qualitative data templates. So all of these are going to be new webinars in our series. Next slide, please. In April, we start again anew with our annual address from Dr. Lynette Scott. She is our deputy director here in the grander scaled organization of EDM. And we'll go through the rest of the year as planned. Next step. So again, if you have any questions and you're posting them in the chat, we can get to those today. I believe we have some time. And then if you have something that comes up later, you can go ahead and send it to mcdss@dhcs.ca.gov, and we'll get to it there and send it to subject matter experts who can address it directly. Do we have any questions that we want to go over? Does anybody want to read those to us? And all right, I'm going to go ahead and turn it over to Dr. Eugene Stevenson, and he'll address as many as he can. Thank you.
Yes, thank you, everyone. Thank you, Amy, for a wonderful presentation, and to all the participants today. Everyone did an excellent job. We're taking some time right now to go through the chat and find the questions and answers and put them together, and I will be sure to reiterate some of those. So kind of going from the bottom to the top, the ECMCS question about JSON. It is required for the plans to try to submit, as Tyler elucidated too. The DHCS is going to monitor the submission. However, data quality per se will not be addressed at that time. It would be addressed later on, as Tyler said, in February, March, April submissions. Thank you, Tyler. Scrolling up through the chat, we had a question about monthly data check reports, and Deb put the answer in the chat. That monthly data check reports are sent to the plans. They contain the error information for the 17 data quality checks, including the past thresholds. If there's any questions about that, as Amy said, please send the questions directly to Deb's area, or you can always send it to us, and we will be sure to make sure that she and her staff receive it. Still going through the chat. Documentation Center access, if it hasn't been granted, please just ask for it. Staff are currently fulfilling those requests, so it'll be to you very, very shortly. Padma, what websites are used by DHCS to verify site HCI numbers? We're going to get back to you specifically on that one. And then after the answer is provided, we'll also post it, the FAQ. A copy of all the slides will be posted on the website. Also, there's a video. All these presentations are recorded, so they are available for training material or for refresh. And also, as Amy had said, there's an FAQ page that's maintained monthly. I don't see any more questions. Any more questions?
Eugene, it's Jeff. Did you address the question about, is any of this webinar about BH plan data?
No, I didn't. Thank you.
It was an early one, and it might be worth just talking about when we are going to discuss behavioral health plan data. That might be helpful.
Yes, thank you, Jeff. That's
Mm-hmm.
Thank you. So, behavioral health, yes and no. As many people are aware on this webinar, managed care plans address mild to moderate behavioral health, whereas the counties address moderate to severe, and that's called specialty mental health. So this particular webinar isn't covering data quality checks as behavioral health relates to managed care plans. However, in the future, that will begin to occur. So definitely look out for that. And that's a wonderful question. Thank you so much. Two more questions?
It looks like there's a few that just came in pretty recently. There's one about the companion guide. When will the new companion guide be sent out?
Yeah, I'm sorry. It may be up to me to answer that, but the way I would answer it is the companion guides are posted to the documentation center, and plans will be notified when those are posted. But if this is about the 274 medical provider data file, I'll have to consult on the scheduling there to give you a precise day when that's going to be posted. And on the next question, if I may, I wanted to comment. From time to time, the PACES system, for various reasons, builds up a processing queue that can affect the turnaround time for submitted files. So in other words, you may submit a file and no response file shows up within the 48-hour window. That can be indicative of a production queue that has built up. Those can take sometimes several weeks to resolve, and during that time, files are being processed as quickly as possible. If that's the case, then it means your file is in a processing queue, and it will be processed as soon as possible. If you have further questions, reach out to your analyst, whether it's provider data or encounter data, and they can help you with a little bit more detail. So just something to keep in mind. We are currently running a queue. I hear it affects more encounter data files than provider data files. Those could be impacted as well. So I hope I'm addressing that question from Sanjot about the FTP not responding. If I didn't answer that question, please provide a little bit more detail. If it's about accessing those folders, we can talk about that as well. And I think Tyler addressed the questions about tech specs for the JSON files. Those are up there. Send a request in and we'll get you added right away. I'm actually working on that right now. And I think those are the questions that I can answer. There looks like there might be another one in there. I'm sorry. Go ahead.
I think I'm going to add a little bit to what you were saying. Yeah. There was also a comment in there about if there's a
thanks, Lisa.
If processing time affects the submission for, like, say, 274, traditionally or historically, when there is a processing issue with cases, then the deadline is extended. It's not all the time, it's not every time. However, like I said, traditionally and historically, when the department is having some type of a technical issue processing and accepting the files, then that deadline is extended. However, every instance is unique.
Yep.
Do we have any other questions?
I don't see anything further at the moment.
Awesome. Well, with that, we here at DHCS, everyone that has presented and for everyone here at the table, we appreciate making time to meet with us today and talk about data quality and talk about the future of data submission. It's an exciting time as we move into the holidays. So we look forward to continue working with you. And if there's ever any questions, please use any of the links to send in those inquiries and we will get it to the subject matter experts as soon as we possibly can. I hope you have a great rest of the day. Take care.
Thanks, everyone.
Thanks, everybody.